Okay, thank you for inviting me to present my work in this group. So hopefully it will be okay. And if I run out of time, just let me know. Okay. And one more thing, if something happens like the internet connection goes, just let me know because sometimes it keeps on going on. I'll be talking about the Indian diaspora in times of COVID. So before I start, I want to give you an introduction about this project because this project is part of a big project which me along with Dr. Asanullah of Brunei University, Darussalam, we have been doing it since the start of the COVID, around April 2020. And it's kind of like all the Asian diaspora who are outside their countries and now like facing difficult times in wherever they are there. But this, as I am an Indian, so I chose the Indian diaspora, and that's why I have been doing since April 2020, and it's kind of still ongoing. This project is still ongoing, but because now the vaccines have come, but still again the Omicron or Delta, they are still there. So you can't say that you can't just stop this project at any time. So it's kind of still ongoing. So this part which I have done on the Indian diaspora, it occurred within like April 2020 to November 2021. I have collected the data within that time, but as we cannot go to the places, so we have used mostly WhatsApp or Skype or Zoom to get the data, to collect the data. And the respondents we chose like random sampling from one person, and they refer to others and likewise. So today that I want to speak, but as you know that COVID has made our lives totally different from what used to be in one day, because the things that we took for granted, like boarding the flight, like if you have money, just book the flight and board it, that is not possible anymore now. As I am staying in Singapore since 2017, and previously it was like you can go to Calcutta because Calcutta is my hometown, so you can go to Calcutta on a Friday evening and come back by Monday. But these days it is like totally impossible. You cannot do that. So these things that we have taken for granted has changed our lives so completely. So that's the main reason we took up this project, because we thought of doing this at what people like us who are staying outside our country, but back home our parents are there, our families are there, our relatives are there. So how do we feel about it? So that's why we chose this project. So okay, so today I'll be talking about migration, a brief overview and the different types of migration. It will mostly help to some of the undergraduate students who are most interested in doing migration. Then I'll be talking a brief about COVID-19, but as I'm not a person of medicine background, so I'm not going in that details. It's just kind of a sociological overview that we know and we can work upon. And then I'll be talking about COVID-19 and how the migrant populations got affected. Then I'll come directly to the Indian diaspora and how the COVID-19 is affecting them. Then for this study, I have used Commonality as the theoretical framework, which I used for analyzing my data. And then the methods, I'll be talking a bit about the methods, followed by the empirical findings, and finally I'll end with the conclusion. So migration, a brief overview. So whenever we heard of migration, we think, what is it? So migration, in simple words, is about movement of people from one place to another, firstly. Secondly, it's to fulfill their aspirations. Thirdly, to run away from the fears and sometimes of triumphs and of tragedies. And then the second question comes to our mind is, why do people migrate? It is because there are several reasons because why people migrate. They're like voluntary, who migrate due to their own will or due to their own satisfaction. For example, people like us who migrate to have a common particular career path, or those who want to have a good life or want to have a nice work environment which is not available in their own countries. And these are kind of temporary migration, because people, those who go, these diaspora people, and they are mostly called the diaspora or the high-skilled laborers, migrants like we are like temporary people. We don't have permanent citizenship or anything here, but wherever we want, we can go back. And these people are mostly from economically less developed countries, and they go to the economically high developed countries. So as I was telling you, that there are two kinds of migration: one voluntary migration, another is forced migration. Voluntary migration is for those who willingly migrate from their own country and look for better job opportunities or better career path. And these people are mostly from less economically developed countries, and they move to economically higher developed countries or more developed countries. But the other way around is also similar, is does happen, because there are many people from the Western world, they do come to the less developed countries because they get much higher paid, or they get their passion of work, they helps them to come here. And for example of these migrants are highly skilled migrants, the diaspora people, the migrant laborers. As you can see, there are lots of labor migrants from southern part of India. They generally migrate for their good opportunities to the Middle Eastern countries. In Singapore also, there are a large number of migrant laborers from South India. Foreign domestic helpers, those who are again from southern India, a large number of foreign domestic helpers, mostly the maids, they go to the Middle Eastern countries to have a good life, to earn money. But for these people, it's not forced. They are going out of their own will. The second kind of migrants are the social migrants, who are mostly for the marriage migration and the family reunion. For example, in the state of Punjab, previously also and now also, state of Punjab, most of the Punjabi girls, they got married to persons who are settled in Canada. So they go to Canada to meet their husbands, to join their husbands. And there are also sometimes that many of the, and this is called marriage migration, where the wife goes and joins their husband in a abroad country. And there is also family reunion, where parents or your relatives, they come and join you from faraway countries. Like in USA, the Indian origin Americans, they invite sometimes their parents, and their parents come to their place and stay for like 6 months or more than 3 months or somewhat like that. So this is called family reunion, and this is another kind of social migration. So these two are voluntary migration, which you are not forced to do. But there are other kinds of migration where you are forced to go because you have no other option left. For example, political migrants, who are forced to migrate to escape political persecution or war or state policies which discriminate against particular groups of citizens or people who oppose those in power. These people are unable to return home because they have fears of being persecuted and are unlikely to receive any protection from their own government. Examples are refugees and IDPs. A few years earlier, you have seen in Sri Lanka, there has been a war going on since 1983 to 2009, where many people have been displaced. They were forced to leave their houses, their countries, and sometimes their own places, because a war was going on. Everyday people have been killed, girls were raped, and they were just thrown out of their houses. So people were not that much secure to stay there. So they have no other option just to leave their country and sometimes pass across their national border. And those people, they are mostly referred as refugees and internally displaced persons. There are other kinds of forced migrants, like the environmental, because they are forced out of their places because of environmental causes like tsunami or floods or famine. Like in 2004, a tsunami happened in southern India and also in Sri Lanka, where most of the houses were destroyed. People have nowhere to stay, so where should they go? They have been forced to move out of their houses. And lastly, there is the man-made migration, which because of man build some development projects like dam building, road building, or any kind of factory building, which are the major sources of displacement related conflicts. Medha Patkar has been active in many of those protests, in many of those displacement related protests, because she was really horrible about those ideas. So these are kinds of the migration that we can see. Now I'll be talking a brief about COVID-19, which as of now, we are not that much sure that it has it's about its origin, but still we know that it's originated in Wuhan in China in November, December. But there are many controversies regarding it, as we know that many people say that it has firstly seen in France in October 2019, and some also say it was emerged in Netherlands in October 2019. So there is a controversy going on, but still now people believe that it has originated in Wuhan. And this has turned out to be one of the most terrifying and highly contagious diseases, as it transmits so powerfully. And it has caused an impending crisis all around the globe. More than 219 countries have been infected now and have killed countless individuals, and it's still going on. I mean, it has not yet stopped. 2 years have passed, but still the situation is the same. So as we know that there are no such medicine of COVID, and the vaccines are being rolled out, but still the vaccines are not that much of help, because still we are having COVID and new variants are coming and new things are getting discovered every time. So the only measures we believe that can help us to protect ourselves from COVID is like wearing masks, which is a compulsory thing here in Singapore or many of the Southeast Asian countries. As if we don't wear masks, we have to pay a fine of $300 if we get caught. Then washing hands regularly, staying in quarantine if you're feeling unwell, or if you don't want to go out, or if any friends of yours or family members of yours have COVID or are feeling unwell. So stay quarantined, self-isolate yourself, and maintain social distancing of 1 meter. And then the last resort is the lockdown, which again many of the countries are now following and some are not, because of the economic situation and all other things. And as I said, vaccines have already been rolled out, but still things are still the same. And COVID-19 and migrant population, which is the focus of our study. COVID-19, as we can see, that it had an enormous impact on the people migrating out across the globe. The dynamics of international migration, it has been changed dramatically, with a vast majority of airlines and travel restrictions imposed all over, where people have been confined into their homes. They cannot go out, where people like professors, like all the professors here, can say that previously in a year they used to, or in a month, to be specific, in a month they used to fly like twice or thrice at the minimum. And now, since the last 2 years, we have no choice. Just all the conferences, everything is happening online. So we have no other choice than to fly. No other choice of flying. We have to just be confined in our homes. Millions of jobs have disappeared worldwide, like mostly the hospital sector, the aviation sector, the airplane. Many have lost their jobs, and mostly the migrants, they are the worst victims. And because they don't have any secured job, they don't know that if their job is secured, because they are working in some other countries. They are not staying in their own countries. They have to pay their own things. And if they don't get money, where are they going to pay it? Because most of the restaurants in USA, most of the restaurants, most of the small groceries, they have been shut down because of the COVID, because of the lockdowns and everything. And the people, those who work there, they've faced a real great trouble time, because they had no money where to go and how to go. And also they cannot come back home because the flights were being cancelled at that time. And it was really difficult to get a seat in the Vande Bharat that was operating at that time. Migrants got stranded for various reasons. Firstly, because restrictions on travel and the related drop in international flights. Even I can also share my own experience, as I was at that time working in Brunei in 2018. So I was in Brunei at that time when the COVID started, and I was stuck there because there were no flights flying, and my family, my husband, my daughter, they are here in Singapore. So I also faced a lot of trouble while coming back, because we have to do this, you have to do that, and all other things. And many also faced loss of jobs and income, lack of employment opportunities, loss of residence permits, and lack of resources to return home, which have all impacted their mobility. Because if you still have money, you don't have a flight, because you can't go back. And some people, like in Australia, some of our respondents in Australia or in Denmark, they said that they have the money, they have all the resources to go back home, but they don't have job. So they cannot stay here. they also don't have residence permit. As they don't have job, they don't have their residence permit. So how to go, what to do? And they have been like detained in the airport. They have been struggling to leave properly, so they were facing really hard troubles. But the most difficult situation, we believe, is for the millions of migrant workers who are in deep predicament, because they are mainly the daily wage workers. So if they don't go out for work in a single day, they will lose their job and they will die. I mean, if not die of COVID, they will die of hunger. And because as also in India, we have seen that when the lockdown started in March 2020, many of the migrant workers were asked to go back to their homes because they had no way of staying at the on-site. And also they cannot go back by any bus. They cannot take any bus or car or anything because nothing was flying at that time. So they had to walk like miles, hundreds of miles or kilometers in barefoot. And sometimes they were also, many of them died because they were hungry. They couldn't find food. Everything was closed. And even the most challenging thing, that the refugees and the IDPs, they are the most challenging thing because they lived in refugee camps, and the camps is like overcrowded. They have little tiny shacks in protracted conditions. For example, the Rohingya refugee camps, we worked with them, and many of the respondents said that they stay around in a small hut, like which is 12 centimeter or 14 centimeter at the most, and where around 10 to 12 family members stay together. So you can imagine how overcrowded that tiny shack must be. And due to dense geographical proximity, overcrowded accommodations, lack of sanitation and hygiene facilities, because for them, they don't have their own bathrooms or own toilets. They have to share their bathrooms and toilets with another 10 families. So 10 or 12 families use one bathroom. So you can see that how much hygienic problem they face, and how can they be protecting themselves from COVID, where hygiene is the most important thing that you should follow. Lack of access to healthcare services in the host communities also put them in the most dangerous condition, because being refugees or IDPs, they are the least bothered populations. Mostly the priorities are given to the citizens first, then the high skilled people, and then they are the most neglected people. And now I'll be talking about the Indian diaspora. Diaspora are transnational group of immigrants living abroad in host countries, but maintaining economic, political, social, and emotional ties with their homeland and other diasporic communities in the same origin. And there are around 18 million Indian diaspora all over the world, which is, as Professor Munar said, it's world's highest number of diaspora in the world. And in US only, there are around 4.8 million Indian diaspora staying there. And they are like diverse and heterogeneous. They are relatively wealthy than the other people, than mostly the unskilled or semi-skilled workers. They are mostly wealthy people because they have gone there to make their lives in a better condition. So they have got a good job and good salary. They have been thriving mostly in Western countries like Europe, US, Canada. They are fully, as I said, in USA only you can see around 4.8 million Indian diasporas, but also in Canada, Europe, and in Singapore and many other parts of the country, you will find a huge number of Indian diaspora. And one of the main reasons that I told you, the motivating factor for them are the higher standard of living and the several ample opportunities they can have from those countries. But even when they were having a good life in the diasporic countries, still when COVID came, it was kind of like adverse effect to many of them, especially to the retail and leisure and hospital businesses, because they were closed down. There are in USA mostly, there are many Gujaratis who have their own grocery shops. They are not that much, some were not that much renowned, but some are very small and some are okay. But during the lockdown, they had to shut down their shops because they can't open it, and as they have shut down, they don't have the money to pay their workers also. So they were in a very bad situation. And due to the COVID, those who were outside, unskilled and semi-skilled, were mostly affected. For example, in the Middle Eastern countries, the laborers, those who came from India or from Bangladesh, they really suffered, because at that time when the lockdown started, they were not allowed to work, and as they are like daily wage workers, so every day they used to work and get money. But as the workers, they are not working, so they didn't also get money, and if they don't have money, how are they going to eat? And it also happened that several of the workers in the Middle East, they asked back home in their country, in India and in Bangladesh, to send money so that they can buy some food and can have it. And also their vaccination things also gave them a lot of trouble, because they were not offered free vaccinations. But in other countries like Singapore, they are really in a good condition, because they have been offered free vaccines, they have been taken of good care, and also the diaspora people, they have been going through some problem like in the Middle East or in USA, but overall they were in a good condition, not that much of a bad condition. And millions were forced to sign up for unemployment insurance, because many of the people, as I said, in USA, they couldn't keep their shops open, so they were forced to sign some unemployment insurances. And healthcare were also not supported in many of the cases, because some of the Indian diaspora people, those who are aged mostly, they were not given proper health care, or as they has preconditions, so they can't get vaccines, and they were suffering very badly due to the COVID, and that main reason for them that their health conditions deteriorated, their families were really in a intolerant situation. And also because of the hospitals were overwhelmed with the COVID patients, they were also not allowed to come in. I mean, they didn't get admission in many of the hospitals during the COVID time, when the COVID was in peak in either USA or in UK. Also, some of the students in UK, I would also like to share that they were really in a bad condition, because they were studying and they took huge amount of loan from India, and their parents have been paying that. And many a times their parents doesn't belong to that wealthier family. So those students, they usually do part-time jobs in UK or in USA and pay for their own daily livings. But due to this COVID, when lockdowns happened, they lost their part-time jobs, and at that time they were in a very difficult situation, because they don't know how to support themselves, because they don't have the resources or the sources to earn money and how to live a life. So they wanted to come back to India, but at that time Vande Bharat, I mean, the flights were also not available, and Vande Bharat was also, they had to pay a lot of money, around 50,000 I think, for each of them. So from where to buy the ticket, so they were in a really terrible situation. And as I said, that I have used the concept of commonality as a theoretical framework, which refers to collective processes, but it also relates to how individuals feel and embody belonging in collective constellations. Essentially, it pertains to the feelings, concerns, and experiences that we all share in common, such as language, culture, religion, lifestyles, norms, values, observations, and memories. On the one hand, it relates to a sense of self that can be experienced single-handedly, and on the other, it is shared and executed collectively. For example, in India, it's very difficult to have a communal experience, because if I am from Bengal, so if I go to South India, in any of the states in South India like Kerala or Tamil Nadu, it will be very difficult for me to have a commonality with other people, because of a difference in language, of a difference in culture, lifestyle, norms, and observations. But if on the other hand, if I go to Bangladesh, it will be a bit easier for me, because of the commonality in my language, sometimes in the food habits and culture. And also it goes also same for the people in Tamil Nadu. If they go to Sri Lanka, in the northern part of Sri Lanka, or northern part of Sri Lankan people, they come to Tamil Nadu. That's why you can see a number of Tamil refugees, Sri Lankan Tamil refugees in Tamil Nadu, because they find this commonality in their language, culture, and religion and lifestyle. So they have moved to they chose Tamil Nadu over any other country. So with this concept of commonality, I have been trying to analyze my collected data to show how all the Indian diaspora have been facing their, how have been experienced, how their communal experiences, how they share their experiences, they have their common things. Now, the methods that I followed, as I already said, that I collected data from April 20 to November 2021, and some of the secondary data I collected over internet search and documents, some online reports and newspaper articles, because at that time it was not that much common to have so many articles on this topic. And there were articles, but they were mostly on the medical science or on the natural science, which is hard for us to have it and use it in our own work. Well, I also did some extensive literature reviews on this pandemic. Those were mostly the online reports I have been referring to. Long-term impact on the migrants, mobility and migration, and the studies on the spatial spread of diseases. As I said, that I did some informal interviews which were conducted over Skype, Zoom and WhatsApp with the respondents all around the world, and they were selected on the basis of snowball technique. I mostly spoke to Indians in Singapore, Brunei, Hong Kong, Macau, Italy, Spain, US, Germany, Netherlands, Denmark, Italy, France, Qatar, Kuwait, and Saudi Arabia. And the questions that I asked was how the situation was like in their place in terms of their job, contract, health services received, contacts with the families, income, possibility to go back home, and any other hindrances. How their lives have been affected, and do they fear any kind of job loss during this crisis? When do they feel they can again see their families back home? How can they reintegrate? And if they have any hopes in their mind. So the findings that I would like to share with you, it's not a whole one, but I'll be sharing with you just a bit of them because of time constraints, as you can see. So mostly one of the questions that I confronted while talking to them are their uncertainty and pain that they have because they cannot see their own families. This is the most important thing, because most of them, as I have given in my title, will I be able to see them ever again? This is the most common question that most of the Indian diaspora people, they have in their mind, because they are scared about their family. Most of them said whenever they were calling their families around April, March 2021, they were hearing that this person had died because of COVID and he is not doing well. So this is the most basic question and most scary thing that they're having, which I also faced. And then it came with the lockdown. I became scared. Anytime I may lose my job. And this is another most common question, because common statement for them, because they were, even if they were thinking that, okay, I'll be fine, but still being a temporary temporary resident in a country, you always have that scare or their feariness that anytime the government might say that, okay, you have to get laid off and you are the worst person to get affected because they don't owe you and we owe them, but they don't owe us, and they don't have any much responsibilities or rights towards us. They only have that towards your own citizens. And that is kind of true, because every country will have priorities for their own citizens first, and then they will look for the migrants or the others or the diaspora people. So every time with the lockdown, every time all the people, they have this thing in their mind that they might lose job at any time. Mostly in USA, as I was saying, the grocery, those who have small groceries, they were like, oh, I might lose my job, because the workers were working in the groceries. They're saying, oh, I may lose job at any moment. Even the information technology persons, the IT sectors persons, they were also, those who have H-1B visas in USA, they were also like, anytime we might lose a job, because as Trump was saying, no more Indians now. So anytime they can reject our visas. So this may happen anytime. Apart from this, nevertheless, they were happy and very much content with wherever they were here. Like citizens, like in Singapore, the Indian diaspora, those who are in Singapore, most of them, they were saying that even we are not citizens of this country, yet we are getting the same kind of treatment as the locals during the time of COVID. They have been getting free masks, free hand sanitizers, everything free. The cost of getting swabs, they are free. Vaccines are free, whereas in India, many of the times you have to buy your own vaccines to get it fast. But in other countries, but in Singapore, it's almost free. It's kind of free. I mean, not almost, it's free. And also USA, you are getting everything for free. Only if you have to travel to outside world, in outside country, and you come back, then only you have to pay for your swab test. Otherwise, everything is free. And you are getting full support from the health services and full support from other country members and everyone. So those are in Singapore or in USA, they were like nothing to complain about, as you can see. They were also grateful for the support from the other residence countries, like in Indian diaspora in Denmark. They were saying that we are alive in good condition. We don't have to think of ourselves because we are good. Only we are worrying about our parents back home because the situation is terrible there. And mostly the migrant workers, they are really happy. In Singapore, the migrant workers are really happy because when the lockdown started in Singapore, it was called circuit breaker. When the lockdown started in April and it continued until June 2020, and all these 2 months, the workers, all of the workers were provided food every day. They were also given the basic salary, like $400 every day, and so on. So another Indian diaspora in Europe, they were saying that they have both got the jobs and now they are waiting for the boosters. And in India, compared to them, the boosters now not yet available, and many are still waiting for their third dose. And now, in conclusion, I would like to say that the pandemic has changed the domain of global migration, and so has many of the policies has also been changed. Several countries have made drastic changes, like they have restricted many migrants from entering their countries, like South Africa has made borders around Zimbabwe so that Zimbabwe illegal migrants cannot come in. Around 100 million migrants chose irregular routes to migrate because there are no regular means now, and because of this, some of the desperate migrants, they are seeking irregular means to migrate by using smugglers, traffickers, and other illicit groups. Cases of xenophobia, discrimination, and stigmatization has also increased. Many of the migrant workers, they have been considered as major spreaders of the virus, as Professor already has mentioned that they are the super spreaders. For example, when Iran got a lockdown, so around 15,000 Afghan migrant workers, they rushed back home, and in Afghanistan they have been referred as the super spreader of the virus, as they were thought that they have spread the virus. COVID-19 has changed most of the things, mostly in the refugee camps, like places like mosques and markets, they are empty. Children, instead of playing in the streets, they are now confined at home, and families, as I said, all the 10 or 12 members, they are spending time together in one single space. Though vaccination programs have started, but still it's not that much sure how much it is working, because people are still getting the disease, and still there are lockdowns, flight bans, and border closures are still going on. But still, talking about all these negative things, there are some positive things which has happened, that is economic slowdown. Because of this economic slowdown, the less travel and less commerce and fewer emissions, it has come to be a natural climate, and the green thing has come up. Many of the migrant populations, they have their great opportunity to revisit their future plans, because of this travel ban, many of them cannot fly away now. So they can think and have their own futures back home. Deficiencies of health professionals, they might lead to more job opportunities for asylum seekers and migrant populations. For example, Portuguese government has already granted citizenship rights to many migrants and asylum seekers who have residence applications underway. And Germany's agriculture minister also suggested to give temporary work permits to all the asylum seekers. And finally, refugee regimes and host governments, they may take appropriate lessons on how to handle such a situation if anything ever happens, without any less number of fatalities possible. So these are the references I used, and thank you.